Perfect. Hi, everyone. Thanks so much for joining us and welcome to our report launch for our latest piece of research on enablers of digital inclusion in primary care for Gypsy, Roma and Traveller communities. I'm Rosie. I'm the Health Policy and Projects Coordinator at Friends, Families and Travellers, and I'm joined by my lovely colleagues from Roma Support Group, Samina and Mihai. And together with my colleague Michelle from FFT, we make up the research team on this project. And I'll walk us through the agenda. So we're going to start off with a little bit of about us, a bit of an introduction to Friends, Families and Travellers and Roma Support Group and the context for the research. And then we'll give a really brief introduction to Gypsy, Roma and Traveller communities in general, before we start getting into the health context and the body of the research. So we'll walk through our methods and our findings, as well as some of the key recommendations that we've drawn out from those findings. And then at the end, we're going to have 15 minutes for a Q&A. And depending how we get on with time, we're going to try and include a 5-minute tea break halfway through, but we'll see how we get. Lovely. So this report was produced by Friends, Families and Travellers and Roma Support Group as members of the VCSE Health and Wellbeing Alliance. So Friends, Families and Travellers, or FFT, are a national charity based in Brighton, and we work to end racism and discrimination against Gypsy, Roma and Traveller communities and to protect the right to pursue a nomadic way of life. We support individuals and families with the issues that matter most to them, at the same time as working to transform systems and institutions to address the root causes of inequalities faced by Gypsy, Roma and Traveller people. Roma Support Group, or RSG, is a Roma-led charity based in East London, working to improve the quality of life for Roma refugees and migrants by helping them to overcome prejudice, isolation and vulnerability. Every year, RSG supports around 2,000 Roma people with access to welfare, health services, including mental health, education, financial inclusion, campaigning and policy, housing and cultural activities. So the report was funded by the Health and Wellbeing Alliance. So the Voluntary Community and Social Enterprise, VCSE, Health and Wellbeing Alliance, is a partnership between voluntary sector representatives and the health and care system. It's jointly managed and funded by the Department of Health and Social Care, NHS England, and the UK Health Security Agency. The Health and Wellbeing Alliance mission is to enable policy, commissioning, and provider organisations to design services and support based on the needs of people and communities who face disadvantage and exclusion. So together, we work to improve access to health and care services and support for those who experience barriers, ensure health and care providers and policymakers are supported and challenged to embed inclusion in service design and improvement, and improve inclusivity and co-design across the voluntary sector. So we'll give a really quick introduction to Gypsy, Roma and Traveller communities now, but there is much more info included in the report itself. So the term Gypsy, Roma and Traveller encompasses various communities, including Romani Gypsies, English Gypsies, Scottish Gypsy Travellers, Welsh Gypsies and Romani people more widely, Irish Travellers, New Travellers, Boaters, Showmen and Roma. Each of these communities have rich and distinct cultures and histories, and this diversity includes some groups, families or individuals being more traditional with their cultural practices and way of life, and others being less traditional. So it's really important to remember that not all issues or health inequalities that we're going to discuss today will be relevant or applicable to all Gypsy, Roma and Traveller people. There's also a real lack of accurate data to reflect the size of all communities under the Gypsy, Roma and Traveller umbrella. In the 2021 UK census, 172,465 people from Romani, Gypsy, Roma and Irish Traveller communities disclosed their ethnicity. However, it's likely that the official census record is an underestimate of the true population size. And there's several reasons for that, one of which being that people might be unwilling to disclose their identity for this kind of data gathering for a lot of reasons, and also because of the types of categories that are offered in the data gathering. Also, the use of the GRT grouping isn't always preferred. So some people argue that it fails to reflect the true diversity of the communities referenced. So typically we'll say Gypsy, Roma and Traveller, but you'll often find GRT used in policy and research contexts. On the slide itself, and as I say, we will be sharing the slides afterwards, so you'll be able to use them for your own research. This slide will link a video produced by Travellers Times, which gives a short animated history of Britain's nomadic communities, and another video produced by the European Roma Rights Centre, which gives some really important info on Roma communities specifically. So in terms of the health context for Gypsy, Roma and Traveller communities, again, there's a barrier in terms of an issue around data gathering. So there's chronic exclusion across mainstream health data sets, like the NHS Health Dictionary. So it can be really difficult to get a clear picture of the health status for Gypsy, Roma and Traveller communities in the UK. However, the data we do have access to shows that members of Gypsy, Roma and Traveller communities have the worst health outcomes of any ethnic group in the UK. The 2021 census for England and Wales revealed that 14% of Gypsy or Irish traveller respondents described their health as bad or very bad, which is more than twice as high as the white British group. And the race disparity audit reveals that Gypsy and Traveller people are less likely to be satisfied with access to a GP than white British people, and are also less likely to be satisfied with the service they do receive when they are able to access GP services. 42% of English Gypsies are affected by a long-term condition compared to 18% of the general population. And Roma communities experience specific social exclusion factors and barriers in access to health and care services. They have multiple overlapping risk factors for poor health and a life expectancy up to 10 years less than non-Roma communities in Europe. So social inequality across a wide range of areas puts Gypsy, Roma and Traveller communities at greater risk of poor health, as well as of experiencing poor health earlier in life and of facing subsequent barriers to healthcare services. Community members can face multiple inequalities, including economic and financial exclusion, barriers to employment, difficulty accessing adequate accommodation, inequalities in education, disproportionate criminalisation, and social exclusion. So we've included more data on this slide, but it is quite dense, so I won't read through it all. But we know that Gypsy, Roma and Traveller communities experience much higher levels of discrimination throughout their lives, which has a really direct impact on health and well-being. Similarly, Gypsy, Roma and Traveller children have the lowest educational attainment at all key stages and the highest rate of school exclusions out of any ethnic group in the UK, which has a knock-on impact on employment. We know that Gypsy, Roma and Traveller individuals have a higher risk of poor health due to high levels of unemployment, and we've got some stats on that from the census included here, as well as accommodation. So inadequate housing and poor living conditions can directly impact health and well-being. 48% of Roma Support Group's health advocacy project service users stated that they face challenges relating to poor housing conditions, and the lack of appropriate accommodation available for Gypsies and Travellers exacerbates health inequalities. Another practical barrier that's related to housing is that if you don't have a fixed address, this can be a challenge in terms of accessing GP services. So despite the NHS guidelines indicating that a fixed address isn't necessary for GP registration, we know that a lot of patients are wrongly refused on that basis. And again, there's a study linked in the slide that the FFD conducted a few years ago. So to get into our research process, this research project was shaped by the input and insights of Gypsy, Roma and Traveller community members at every stage. So the project also benefited from the expert advice of the Good Things Foundation, our Health and Wellbeing Alliance partner organisation that specialises in digital exclusion. So we began with a literature review to gain a clear understanding of the existing research and resources that are available already on the topic of digital exclusion and Gypsy, Roma and Traveller communities, which we used to then design and launch a survey, as well as a series of focus groups to gather our own data. The survey was developed by FFT and RSG staff in consultation with our NHS project lead and the Good Things Foundation, which is the UK's leading digital inclusion charity. We also worked to make the survey as accessible as it possibly could be, and ultimately gathered 102 responses from across different communities. So to help combat language barriers and low digital confidence among a lot of the participants that we were targeting, we worked with a network of Gypsy, Roma and Traveller advocates who provided one-on-one support to complete the survey. Our 3 focus groups consulted a total of 21 participants, and they allowed for a much more open discussion and more qualitative insights into participants' experiences around digital access to primary care services. So while we discuss the findings, it's really important to remember that these data sets are relatively small, but in the context of very limited access to data on these communities, they're really significant. So we're really pleased to see a really strong Roma representation among survey participants. So we had 47% of participants indicated they were from Roma background, 12% Romani Gypsy, 19% New Traveller, 9% Irish Traveller, 1% Showman, 1% Scottish Traveller, and 4% Other Traveller. So again, that Roma representation is really the result of careful work with community advocates who supported participants to complete the survey despite challenges relating to digital access, language, and confidence. We've also broken down our survey participants by accommodation type. So the majority here, so that's 78%, lived in settled accommodation or bricks and mortar housing. We then had 10% live aboard boaters, 6% of respondents living roadside, 1% in local authority traveller sites, 1% in private traveller sites, and then 3% other. And they were able to kind of give their own answer there, which included things like sofa surfing and living in a trailer. Again, this partly reflects the accessibility of our own research process. So those living in settled accommodation are much more likely to be able to access online surveying, for example. And we've got a quote here from one of our participants, which is, digital access is a great thing, but should not take the place of adequate human interaction, phone or in person. It assumes all people are equal in circumstances, needs, and ability. It's taking over at a rate that isn't ethically viable when you consider that many people are unable to access health services in this way due to financial, cultural, or health-related reasons. And this really summarized our findings really succinctly. So we had several key findings that emerged from our research process, and we've grouped them under themes. So we've got our general findings here, which are low levels of digital platform and services use among Gypsy, Roma and Traveller communities surveyed, low digital skills and confidence, lower access to internet signal and data, low access to devices and equipment, and also major differences between the different communities within the Gypsy, Roma and Traveller banner. So number 1 is digital exclusion. So we've grouped some of our key findings here. So the first of our findings looks at levels of digital exclusion. We asked survey respondents about what kind of devices they owned or had access to. 87% of survey respondents said they had their own smartphone, which compared to 92% of the general UK population. 25% of respondents had their own laptop, compared to 72% of the general UK population, and 17% of respondents said they had their own tablet, compared to 63% of the general population. In terms of internet access, only 38% of survey respondents had their own Wi-Fi, compared to 94% of the general UK population, and 48% of respondents had mobile internet, 48% of respondents had mobile internet, compared to 92% of the general UK population. 4% of respondents regularly used public Wi-Fi, such as in a public library or cafes. So here we have access to devices and internet for Gypsy, Roma and Traveller community members surveyed, compared to the UK-wide data. So you can see the disparity there is quite stark, particularly in terms of access to Wi-Fi and mobile internet. So survey respondents also indicated really stark variations in terms of access and experiences, depending on the specific community within the Gypsy, Roma and Traveller umbrella. Across communities, there's significant variation in smartphone ownership, ranging from 25% for people who identified as other travellers to 100% for Irish travellers and BOTA respondents. There's similar variation in ownership of laptops, and again, the values ranged from 0% for Roma respondents to 89% for BOTA respondents. And tablet ownership, again, varied from 0% for Roma respondents to 44% for BOTA respondents. Internet access would also vary significantly. We had 77% of Irish traveller respondents reporting access to their own Wi-Fi, compared to just 9% of Roma respondents. And we also looked at usage and access trends. We surveyed for kind of general digital usage, for example, accessing social media or email among the communities we surveyed, as well as use of digital primary care services, so we can get a sense of comparison. We found that the majority of Gypsy, Roma and Traveller community members that we surveyed, that's 71%, did use digital means to access social media on a daily basis, and 51% reported checking their email accounts with the same frequency. And that is lower than the UK-wide data, which was around 96.7% of the general population who reported using social media daily. However, this data does show that community members are comfortable utilising digital means for certain usage. And that suggests that adaptations can be made to create digital primary care services that are more accessible and more engaging. So in terms of digital NHS and primary care services, we had 29% of survey respondents reported using the NHS app, which compares to 75% of the adult population of England who are registered users. 40% of survey respondents reported accessing GP services online, 12% or less reported accessing pharmacy services, dentists or opticians online, and 47% reported never using the internet to make health appointments. There are all, again, significant variations in reported usage of digital primary care services, depending on the specific community. For example, 78% of Irish traveller respondents reported using the NHS app, compared to just 2% of Roma respondents. 75% of other traveller respondents reported accessing GP services online, compared to 25% of Roma. 22% of BOTA respondents reported accessing pharmacy services online, compared to 6% of new traveller respondents, and 44% of Irish traveller respondents reported accessing dental services online, compared to 0% of Roma or BOTA respondents. In terms of the barriers to general digital access, the issues that were raised related to English language barriers, literacy barriers, the cost of internet access, whether that was through Wi-Fi or mobile data, and as well as a general lack of confidence with technology. But as that related to primary care services specifically, survey respondents reported a general lack of confidence at a rate of 35%, issues with English language at 32%, literacy issues 12%, the cost of mobile data specifically at 6%, and Wi-Fi specifically at 4%. And then another barrier that emerged from focus group discussion was the lack of culturally appropriate education and learning opportunities around digital skills. So practical training on how to use devices, websites, or apps, for example, GP websites or the NHS app itself, were raised as a potential measure to support community access. So here we have the breakdown of those responses in terms of the key barriers. And we can see that the general lack of confidence in tech was really significant, as well as English language barriers. But again, the experiences of those barriers varied hugely. We know that English language barriers are much more of an issue for migrant Roma communities compared to other communities who grew up in the UK and would have English as their first language. 50% of Roma respondents said that they were not confident with tech generally, compared to 0% of BOTA respondents and 11% of Irish traveller respondents. 33% of Romani Gypsy respondents said they struggled with literacy, compared to 11% of Irish Traveller or Roma, and 0% of Bota respondents. And again, we've got another quote here from our focus group discussion. And it says, "I can't even read the text messages they send me. I give it to my husband or children to help. But to make my appointments online, I can't even read. So making appointments is another level." Our survey respondents also highlighted the importance of maintaining options for non-digital access to care. So generally, it came across that online access is important and useful for a lot of people, but that still we need to maintain other forms of access, whether that's by phone or in person. And that's due to practical barriers as well as emotional or social need for direct contact with care providers. 39% of our survey respondents stated their preference for non-digital access to care, and that's especially true when discussing sensitive health issues. Again, we've got some more quotes here. One is, "I move about often and find mobile data signal is poor. I don't want to rely on internet access for healthcare." Another saying, "Lots of places boaters live have really poor or non-existent phone or internet signal. So having purely online digital services is not a good idea. We can't always access email to check responses." The last one here, which is, "Digital is not how healthcare should go. Feeling cared for requires an interpersonal relationship." And again, someone shared a really positive experience that they had with their healthcare providers, and they stressed that they really like that their surgery doesn't push them to use technology. They said they were very understanding and helpful and realized that talking to a real person is sometimes the best way, especially those with mental health issues brought about by solitude or loneliness. Lovely. And our next kind of key section of the report is the key enablers for digital access. So based on our findings around the barriers, we were able to identify some key factors that do allow people to access services online. A really key one was building awareness, and that's both in terms of awareness among service providers and service designers and policymakers of the needs of Gypsy, Roma and Traveller communities, and building awareness among community members of the digital services that are available to them. Our research showed really low levels of awareness among community members of things like the NHS app, and low confidence kind of accessing and navigating websites and apps that are used by things like GP services or dentists to make appointments. So on the other side of things, designing services in a way that's more accessible for the needs of those communities is really crucial too. And a big part of building up that awareness can be achieved through cultural competency and inclusive services training. So that's offered by Roma Support Group and Friends, Families and Travellers, as well as other providers. And it can really help to ensure that service designers are equipped with the knowledge they need to create properly accessible services. And by the same token, outreach and engagement with community members is also necessary to promote and raise awareness of the services that exist already. Design of apps and websites that prioritize accessibility, simplicity, and consistency were really, really crucial too. So when designing digital interventions, key factors that need to be kept in mind are low literacy, language barriers, difficulties around GP registration, and simplicity of use. Accessing the necessary resources to get online and get onto websites and apps in the first place is also a really key enabling factor. So accessing devices, equipment, and the internet remain a major barrier to use of digital primary care services. Facilitating access to necessary resources, whether that's phones, laptops, or data, is a really important enabling factor. Planning and implementation of these actions should take into consideration the demographics and circumstances of targeted communities to ensure that the relevant resources are provided. So we know, based on our findings here, that different communities would require different types of support. For example, nomadic, gypsy, or traveller community members may require more support accessing data or Wi-Fi, while Roma people may benefit more from training or one-on-one access support. Access to culturally pertinent support, training, and resources is also a key enabler. Working directly with people from Gypsy, Roma, and Traveller communities to improve digital skills can be one of the main enablers to increasing access to digital primary care services. Developing culturally pertinent tutorials and training materials can be really helpful. For example, these resources could raise awareness that online services and apps exist while providing accessible and culturally relevant info on how to use them. FFT have produced a tutorial on the NHS app, which is linked on the slides here, and Roma Support Group have created a video series on the COVID-19 booster campaign. So from our kind of key findings, we drew out some conclusions and some good practice examples. The main conclusions were that there were significant differences in experiences across the different communities, and to combat barriers will require specific adjustments that are tailored for the community in question. There was also major preference for face-to-face interactions over digital, and that is to do with the barriers to access that we mentioned in terms of devices and confidence, but also a social need for a more personal interaction in terms of especially the more sensitive healthcare issues. There is also some levels of existing engagement, and that can be optimized according to some good practice principles. These can include ensuring services are flexible, so including non-digital options as well as digital routes, developing tailored, culturally pertinent and accessible resources, providing local in-person support as well as online access, designing services that recognise literacy and language barriers, encouraging partnerships between the NHS and BCSE sector organisations, and providing information that is accessible for people with literacy barriers. We've also created some more tailored recommendations that are included in the report itself. They're quite detailed. I've included them on the slide here, but they're quite difficult to read on this level, which I appreciate. But they're targeted to local primary care services, PCN level, ICB level, NHS England level, and for the VCSE sector as well. And you can see that they're broken down by themes. So we've got services awareness around issues of digital exclusion, Gypsy, Roma and Traveller community awareness of primary care services, design with accessibility in mind, access to necessary resources, and access to culturally pertinent support, coaching, and resources. As I say, we'll be sharing these slides as well as the recording online, so you'll be able to come back to these and click through some of the information that's linked. And we also have our contact information on this last slide as well, so you'll be able to reach out to us. So I'll stop sharing so that we can see each other. And if anyone has any questions, you can feel free to raise a hand and let us know, or you can pop it up in the chat.
Hi Rosie, it's Dee. Can you hear me?
Hi Dee, yes, lovely to see you.
I just wanted to say that when I were talking about digital exclusion, but when it comes to things like Livy app and things like that, you have to have ID, and not everybody's got ID either. So that's another barrier straight away. When my mum was really, let me put my camera's not on, is it? Sorry, people.
No worries.
Am I here? It's very dark in this room.
We've not quite see you, but we can hear you fine.
Okay. Can you see me now? When my mum was really ill, and I had to get, and it was all like during the COVID period as well, and I had to try and make an appointment for the Livy app because I couldn't get any other way. And then it took me to different sections, and then when I did get to where I needed to be, it said provide some sort of identification, and I couldn't do any of that. So in the end, I had to ring 111 and actually go through that way to be able to access anything for her. So there is more. That's just one barrier that obviously happened to me, and I know, but there's obviously more barriers when you actually can get someone else to do it for you. There is still problems. It's just what I really wanted to say.
Definitely. Yeah, thank you for sharing that. That's a really, really important one. And we know that access to things like an address and ID, an NHS number, all that kind of thing can be real, real issues for people trying to access services. Um, Thanks for that, Dee. Joe, you got your hand up?
Hi, thanks so much for this. It's great to kind of see it all come together, and it's really, really interesting and important piece of work. So thanks a lot. As you might know, one of the things that we're interested in at Good Things Foundation at the moment is kind of the next piece of this puzzle, which is around the kind of beliefs and trust aspects of engaging with digital health services for a number of different communities who might face those barriers, not just for Gypsy, Roma and Traveller communities, but did anything come out from I'm thinking particularly from the focus groups that you conducted about people's concerns, maybe about how their data might be used if they're accessing apps and digital health services, or any other kind of concerns that perhaps are slightly different to the kind of fundamental access issues that they were facing, but anything else about beliefs or trust?
Absolutely, yeah. So especially, as you say, in the focus group conversations, there was a lot of fear around data usage and where data was going. There's a lot of mistrust of health institutions within the communities we support, because of very recent histories of abuse and discrimination on the part of the state. So it's a real challenge to kind of again, this touches again on the issues around data that we have, the kind of public health level data. People aren't confident disclosing their identity in things like the census with their doctor, all kinds of data gathering exercises. People don't want to self-identify for fear of how that will be received. So that's definitely something that came up a lot. Mihai or Samina, would you like to comment
Yeah,
on that? Mhm.
I can add something to this. Sorry, my internet is not working very well, and I'll keep my camera closed to help things working. Indeed, there were people kind of, when speaking about using primary care services, especially having online GP appointments through videos and so on. Through the discussions we had with people in the focus group meetings, so there were concerns raised um, um, sort of people being concerned around what doctors might think when they see the surroundings in their own bedroom, for example, thinking that they might make all sorts of assumptions based on what they see through the video in their bedroom and so on, and people being concerned around that, people saying, I can't afford a really nice house and something, I have to rent in a house with many people, maybe they will hear noises, maybe I'm working 12 hours a day, 14 hours a day, maybe my room is not very clean, so I'm a bit worried. This doesn't sound right for someone to see into my world, into my sort of life that way, and people sharing that they don't feel very comfortable having, for example, video appointments because of the trust and confidence and so on around that. Yeah, so that's one kind of thing reflected through the discussions we had. Also, we had, for example, people speaking about simply not being able to convey their health issue over the phone when speaking with a GP, for example. So we had clients saying, I was confident I have a face-to-face appointment, but then on the day at the time, I was actually called by the GP when I was, thinking that it's going to be a face-to-face appointment, and instead of saying and explaining about having a kind of a stomach pain, people said, well, I just said my shoulder is in, I have a pain on my shoulder, and that was it. And people saying that they just kind of speaking about the health issues and so on is not just about words, and people felt that, especially Roma people felt that there has to be a visual contact, so doctors can really understand the level of ill um, and so on, in order to get the right treatment. So they said that they feel more confident when they are actually face to face, even if there is a language issue there. The fact that people can look into doctor's eyes directly or the GP's eyes directly, and can convey what they feel through body language and so on, makes a difference.
Thanks, Mihai. And again, Dee in the chat has mentioned privacy, which is a really, really key one. So a lot of the people that we spoke to, especially in the focus groups, again, would be living in very close-knit community, often without many private spaces where they'd be confident not to be overheard. So finding a space where you feel comfortable and safe discussing more sensitive health issues especially can be a real challenge. And we know that there's certain areas of health that are real kind of taboo areas for a lot of these communities. So things like mental health, gendered health issues, sexual health. There's a lot of topics that people will be very uncomfortable with their wider community overhearing them talking to their doctor about, which is the case for everyone. But finding private space would be a significant challenge as well. Yes, Susie in the chat is again echoing that the kind of having multiple people in the house, or if you live on site, having your community around you, that's a real factor in feeling comfortable, which often means that you can kind of go through an appointment and not feel comfortable sharing really crucial details or symptoms, and things can not be resolved despite having had access to a care provider. Is there any other questions or comments, anything anyone would like to share?
I can come in. At some point, someone asked in the chat box, who are the boaters and what is a boater and so on. But before I answer that, maybe we have a hand raised. Yeah, Winnie, I think.
Hi, everyone. So I work in Cancer Alliance in the southwest, half of the southwest region. And I just want to highlight cancer is a very challenging area, especially for underrepresented communities. So it's really great to understand, you know, as NHS is moving towards more digitalization, you know, how do we actually engage with communities? And a lot of the work is being done, you know, because the traditional way of providing services to people for underrepresented groups are not really working. So, you know, we do actually try and connect with particular GP who have a special interest or support for certain groups, as well as health visitors. So it's through the link of, you know, these healthcare professional within primary care setting and volunteering organization, and, you know, ideally have patient partner groups that came from that community would help us all to build a trust and work together, and yeah, to navigate this difficult landscape, really.
Thanks for that, Winnie. And yeah, that's a really, really important point. Cancer, especially for Romani, Gypsy and Irish Traveller communities, as well as others under the Gypsy, Roma and Traveller umbrella, is a really, really sensitive topic. A lot of people don't even want to say the word cancer. It's something people are really uncomfortable discussing or really avoid attending things like screening services. And there's a lot of stigma around it. So it can be really challenging, regardless of all the practical and emotional barriers for online access, just to seek help for things like cancer. And in terms of the earlier question that Mihai noted about voter communities, so I'll actually add a link to the report in the chat, and on page 5 we have a much clearer breakdown of the different communities under the Gypsy, Roma and Traveller umbrella, with a little bit about histories and languages spoken and ethnicities. But voter communities are people who live and sometimes work on boats, and there's kind of, and we'll move around often on the waterways. So there's specific barriers that come with that, and we get into a little bit more detail on that in the report itself. But yes, I hope that answers the question. anything else anyone would like to raise? Any other points or questions?
There was also one point mentioned in the chat box on libraries and the use of libraries. Now, as my colleague Samina mentioned in the chat box, researching on access to libraries was not the kind of scope of this research and this work. But we are aware that often libraries are the only kind of accessible sort of service for those small communities to go online. And we know, at least on the Roma side, we are informing and telling this to people from our communities and encouraging them to go to the local library and access that and so on. But often what we're seeing is that actually going to the library and trying to use the services available there is mostly down to the person who's working in that particular library, how positive, how welcoming that person is, and how open are the staff in the local libraries to accommodate the needs of those small communities. And unfortunately, apart from not having an IT device, we're seeing as it you could see from some of the data included here, there are low levels of education in those small communities, including low levels of literacy and so on. So there are other things which have to be considered when we speak about using digital means, and the use of libraries sometimes is prevented because of that. So you have someone who might want to go to a library to use a computer, but they might not be able to read very well and so on. So that might be another problem. But we know that it works, at least in the case of Roma, especially in a situation when staff there is very welcoming, supporting, and trying to accommodate the needs and so on. So they will sit down with the person and try to, find out what they actually need, what they want to do, and will try to guide them towards that. And once that kind of first initial kind of contact and trust is kind of met, then we are seeing people from our communities telling us that they do go to the library when they need.
I had a question. I can't raise my hand, sorry. Well, two comments really. One was around GPs and whether or not there's an issue, isn't there, clearly, from what you're basically saying around disclosing. So already we've got a problem there in terms of the GPs not even understanding maybe that they need to have take a particular cultural approach. So I wondered if there was any research around that reality or not. I know it's really difficult to gather data, particularly around minoritized communities, and obviously from today it feels like this community really is massively excluded in a way that perhaps other communities aren't. So that was one question, and the other one was, I suppose, around the whole idea of the NHS works very closely, or is supposed to, with the voluntary sector, which is the area I represent in London, around the Community Champions program. And I just wondered if there was any Gypsy Roma Traveller individuals who were aware of that program or who were part of it, because it does seem there's a missing link there potentially with them being leaders in their community and really supporting other of their communities themselves to maybe feel more confident. I don't suppose you've done any research, but in your research, did that come up at all as a potential opportunity to close some of this loop around health and literacy and all that kind of thing?
Definitely. So if I start with the first question, in terms of kind of published data and research on that, I don't have anything that comes to mind immediately, but I don't know if Mihai and Samina have anything else that would be kind of written research to support that. But one thing that we're really pushing for at the moment is a change to the NHS data dictionary. So that's essentially the categories within the NHS data dictionary in England are currently based on the 2001 census. So those ethnicity categories didn't have anything that would be suitable for someone from Gypsy Roma Traveller background. So there is currently no way for on a national level to gather data that's disaggregated by community. So we can't get that public health level data. It is possible on a more local level to kind of add a category in, but it's not visible in terms of the wider data sets. So we're really pushing for a change to update that to the 2021 census categories, which did have a Irish Traveller, Romani, Gypsy, and Roma category. Again, those categories aren't perfect, and we'd love to see more detail in those, and there's kind of people's willingness to disclose. Again, it's still going to be a barrier, but it would be something, it would be a step in the right direction in terms of improving awareness among NHS staff, and B, giving that kind of visibility in terms of health data. And for your second question on community health advocates, yes, there are Gypsy Roma and Traveller community health advocates working in a few different areas of the country, but we would love to see more representation in that, and we'd love to see more awareness around that within the community. And again, there's the barriers that we talk about to participation. We know that does hold some people back from getting involved in that kind of process. So in terms of creating more accessible routes into that program, that would be a really key area that we'd love to see some work done on. But it came up in a few of our conversations that I can recall, but it wasn't widely known among participants unless there was someone in their area who was doing that work. Mihai and Samina, is there anything you'd want to add to that?
Yeah, Rosie, I mean, I guess thinking about this kind of community health champions network, and please correct me if I'm wrong, but I know these are also like kind of volunteering opportunities, which might really be a barrier for a lot of community members that, you know, as maybe Mihai mentioned, you know, work long hours or have additional responsibilities. So really, volunteering comes at a huge cost to some of the community members. And apart from that, you know, from what I've seen, a lot of the information that's circulated, you know, even though it might be presented, you know, in a maybe not an easy read format, but, you know, trying to be as accessible as possible, it's still very much in English. So I guess that there's probably more work there to actually make it accessible for some of our community members. For some, you know, a lot of the barriers that we mentioned might not be valid, but for the most vulnerable, you know, these kind of programs are still, you know, in need of further work to make them accessible, particularly when it comes to volunteering.
Thanks, Amina.
Sorry, Rosie, I can't put my hand up. So I'm Dee, and I'm the founder of the Gypsy Roma Traveller community women's health team here in Surrey. But when we started out in Surrey, I started out online. It was during COVID and people weren't getting access to things, and it was really, really difficult. And I live with a long-term health condition myself anyway. And I've got 2 children with the same condition, which is a genetic condition. So it was really important that we maintain some sort of access and stuff that we needed. So I started that with Surrey nurses team, who are all culturally trained and have worked on many different sites across Surrey for a very long time, but quickly found out and realised that it really wasn't just needed for Surrey, it was needed for so many other places. So because we was online, and anybody who had access to that, we could actually speak to people online. And what we've done is we've kind of built a network now of ambassadors in different areas. So it's gone far more reaching than just Surrey. We talk about a number of medical issues. We have nurses there every time we have a session. We also have the CQC attend every time we have a session, in case there's any problems that has arose between the last session and people need help in making a complaint and stuff like that. And we're getting word out about vaccines and many other things. We've taken women for screenings. Nurses have attended with them. And we have one-to-one breakout rooms, so there's privacy as well. So although the digital stuff is hard for some people, we have managed to maintain a reach, and the group's now been running for nearly 2 years. And we proudly won the FFT Inspiring Project Award this year, 2024. Thank you. So anyone's welcome to join that. It's a hub, and it's online, and we run every 8 weeks, but we also can answer questions in between as well. And what we want to do is try and link up with nurses in other areas where them ambassadors are now, and so that they get culturally trained as well. So I think it's just a case of working together to make sure that you, in your area, you can put us in connection with the nurses that need that cultural training, and then work together with the women's health team. It's all GRT led, so it's not, you can just come and we're not going to be your tick box, because that's not what it's about. It's a safe space for women that need it. They've never had that. They can also share their lived experiences. But what we do offer is, if someone's got a genuine thing that they want to come and actually bring to the group that's going to actually help the Gypsy, Roma and Traveller community, you can book a space with us for 15-20 minutes to come and talk to us about what it is you're offering or is needed or whatever. And the women are very vocal in telling what, you know, their side of the story, or what is needed for themselves as well, and how things should be done. So I'm just throwing it out there, and I'm not trying to take anyone's thunder, but just to let you know that it's there. Yeah.
That's brilliant. Thank you, Dee. And I know you popped your contact information in the chat earlier as well, so you can people can scroll up and find that if they'd like to reach out. So we've got less than a minute, so I just want to say thank you so much, everyone, for joining us. I'm sorry about the tech difficulties, very on the nose, but it's been lovely seeing you, and the Q&A especially was brilliant. So thank you for your contributions, and hopefully see you again soon. Lovely.
Thanks very much. Thank you.
Thank you very much.
Thanks, guys. Bye now.